Hello friends, this is Dr. Tushar from Diabetic Foot Clinic. I'm going to talk about diabetic foot. Now you all must be aware about a term known as diabetic foot. Diabetic foot is a disease that affects the foot when you have long-term diabetes. Now the causes of diabetic foot, there are three major causes which I can illustrate. First, uncontrolled sugars. Second most important cause is vasculopathy. In medical terminology we call it vasculopathy. In the layman's language it means low blood supply to the foot. And third most important cause of diabetic foot is diabetic neuropathy. Now I'll tell you in details about each point. Uncontrolled sugar can be, you must be thinking that uncontrolled sugar could be a reading of 400, milligrams of sugars, or maybe somewhere around more than 200 or something. But if you want to understand what do you exactly mean by uncontrolled sugar, it means the HbA1c, or the average blood sugar level of a particular person, should be somewhere around between 6 and 7. The reading should be between 6 and 7. If it goes above 8, 9, 10, or then it means your sugars are uncontrolled sugars, which is the average. HbA1c is the average blood sugar level of last 3 months. So that gives us a picture, because day to day sugar can change as per what you have eaten, or what you have your activity on that particular day, or what you have eaten on that particular day. It can change, but your average sugar do not get affected by all these factors. So that is one. The second important cause which I told was vasculopathy. That means low blood supply. Now, over a period of time, when you have diabetes, your blood vessels tend to constrict, and the blood which flows to the foot from the heart goes, it becomes less than what is required. And because of lack of blood supply, if you get some wounds on the foot or some ulcers on the foot, it does not heal. It takes a very, very long time. And of course, the management of vasculopathy is a total different topic which I will cover some other time. So this happens. And the third point, which is the most important and commonest cause of diabetic foot, what we see in our practice, is diabetic neuropathy. Now, what do I mean by diabetic neuropathy? You must have heard about this term, diabetic neuropathy, but what I exactly means is nerves are there in the body for sensations. So when you have good nerves and you get pricked or hurt, or you get some wound, you immediately get pain, or you get that sensation of discomfort. Now in diabetes, when you have long-term diabetes, your nerves tend to get affected, they become weak, they are damaged, and because of which you do not have that protective sensation which a normal person will have. Now this, as a result of this, what happens is, if you get a wound, or if you get a prick, or if you get a hurt, in a normal person they get pain. In a diabetic, they do not even realize that how much how much damage is done to the foot. And because of this factor, most of the time diabetic foot comes to us at a very late stage, because they themselves do not realize the pain or the severity of the infection. So I by telling you all this about these causes, I wanted you all to understand the cause of diabetic foot. Now, because once you get the ulcer, once you get the infection, you do come, people do come to us after that. But we would like our patients to be aware about what is diabetic foot, so that it can be prevented. And prevention is, in diabetic foot, I would say, is the most important key to because this I am not saying, as per statistics, even the amputations which happen each year in a diabetic, those can be saved by 50 to 70%. Amputations can be saved, and by simple measures you can save it. So I wish all diabetics to remain and have a healthy life, and take care of your feet. Thank you so much.